All right, let's chat a little bit about portal hypertension. So portal hypertension is liver hypertension, okay, or liver or portal vein hypertension that's leading to the liver, I guess is more specific, more accurate. And so what is going on here is that we have two different venous systems going on. Okay, we have one venous system that the liver controls, and this is called the portal venous system, and this is a venous system that's taking blood from the GI tract and the organs like the spleen and the stomach and the lower part of the esophagus, and it brings blood to the liver to cleanse before it goes back into the heart and back into circulation. Okay, and so that's what's going on here, is that we have all these organs that are using up the oxygen in the blood, and then the deoxygenated blood is being pulled out of the organs, brought to the liver, and being cleansed before it goes back. Okay, so that's typically what we see through the portal veins. Okay, now you do have another set of circulation which is called systemic circulation, and systemic circulation is the blood that's returning to the heart that's outside the organs. Okay, so from your limbs and your skin and those types of things, that's all systemic circulation, and your muscles, that's all systemic circulation, and that's returning back to your heart without actually going through the liver, which makes sense. I mean, the blood that's actually doing a lot of the work in the GI tract and the spleen, those types of things, that's obviously blood that needs to be cleansed more often, as opposed to stuff that's in the muscles and the skin and the limbs. Okay, that's not nearly as dirty or as exposed to certain things as the stuff in the organs are. Okay, so that kind of makes sense that it doesn't have to go through the liver in order to be cleansed if it's coming for systemic circulation. Okay, so why is this important to know both? Is that they actually interchange, they actually cross over with each other. Okay, so there will be capillary beds that have both systemic circulation and portal circulation connected together. Okay, and typically it gets split between the two of what goes where, simply because the pressure in the systemic venous system and the portal venous system typically is the same. Okay, and so it doesn't really favor one circulation over the other, it just simply goes to the one that it goes to first, okay, in that capillary bed. Okay, so that is how portal portal circulation and systemic circulation work. Now, what happens with portal hypertension, okay, and this occurs because of liver damage, okay, cirrhosis, some severe cases of fatty liver, hepatitis, these types of things, all can cause portal hypertension, and this just simply damages the liver, and this means that the liver doesn't have the ability to filter blood nearly as well. Okay, so if it can't keep up with demand, that means that blood is now going to back up, or there's going to be increased pressure in portal hypertension, okay, or in the portal veins. Okay, and so if there's an increase in pressure in portal veins, remember, fluid will take the path of least resistance. Okay, remember when I said that systemic circulation is connected to portal circulation, okay, in those capillary beds? Well, if the increased pressure is on the portal side, okay, fluid is obviously going to be more likely to go in systemic circulation as opposed to portal, because there's too much pressure on the portal side to be fed that way. Okay? And that's why, and so that's where portal hypertension comes from, is that pressure in the portal veins. Now, why is this a problem? Is that it actually leads to varicose veins. Okay, so esophageal varices, okay, is actually due to portal hypertension. Okay, is that we have too much pressure in the venous walls on the portal side. Okay, and the venous walls are not very thick. Okay, they're not like arteries where they got nice thick vessels that can handle high pressures. Okay, the venous side of things can't, and so that's where varicose veins come from, is simply from portal hypertension, and those walls of those vessels or those veins can't handle that hypertension, and they begin to bulge. Okay, eventually they burst if they're not treated, and that's where we get varicose veins and emergencies like esophageal varices. Okay, so hopefully this is helpful for you and you understand portal hypertension